We've got the opportunity coming up with this general election to put the focus on the NHS, to let the politicians know that we care, that we really care about what happens to it. We care about the services we receive, and we care about the staff who provide it, the nurses, the doctors and the ancillary staff. Most of us, if probably all of us here, have used the NHS, whether a GP or a dentist, a hospital visit, inpatient or outpatient. It's been there for all of my life. It's been such a consistent part of my life that I've taken it for granted. But we can't afford to do that anymore. More and more of the services being privatised, handed over to large companies like Virgin Care and Capita. Services that they can make money from, our money. We're in grave danger of returning to healthcare only for those who can afford it, returning to paying or suffering. This government is starving the NHS of the funding it needs. It is being very cynical, starving it of the funds so it cannot do the job it is here to do, and then telling us that privatisation is the only way forward. It was there when I needed it. It was there when my son was ill. It was there when he was born at Bournemouth Hospital and when my daughter was born at Poole Hospital. But will it be there for will it be there for them when they grow into adults? And will it be there for their children? I hope so. We cannot entrust the future of the NHS in Bournemouth to an MP who mocks it. We need to defend our NHS. We need to do what we can to preserve it for future generations. Use your vote on the 8th of June. Get your friends and your family to use their votes. After the election, tell your Member of Parliament how important the NHS is to you. Hold your Member of Parliament to account for what happens to it. At Bournemouth Hospital, large sums of money are being spent on changing normal wards into luxurious private patient rooms, while other services are being decimated. Savage cuts of £158 million to the National Health Service, demanded by the Conservative government, has led the Dorset Clinical Commissioning Group to undertake a clinical review. This is part of the rolling out of the government-demanded sustainability and transformation plans to expedite privatisation and the rationing of healthcare. This review is threatening the maternity unit in Poole, where my daughter was born, proposing the downsiding of Poole Accident and Emergency Unit and shutting the Special Care Baby Unit and Kingfisher wards in Dorset County Hospital. The numbers of doctor surgeries will be reduced. People will have to travel further and wait longer to see a doctor. You and your families may have to travel further and wait longer to see a doctor. The Bournemouth Hospital team, which arranges care packages for vulnerable patients before they are discharged, is going to be disbanded, with all 5 workers being made redundant. If you don't object, and if you don't protest against the underfunding, the cuts and the privatisation of the NHS, it may not be there when you next need it. It will not be there for your children, and it will not be there for your grandchildren. We have to let the government know, when it is elected on the 8th of June, that the NHS is not a cash cow for private companies.